Hi, hello. Today we are with a new question pattern, that is medical coding interview questions UAE. So, I have added a few questions which I know, which are frequently asked at the time of interview. Not only these questions, there are many more questions are there, which will be added as a second and third part. Okay. So, first question is, what are the main code sets used in the medical coding? As all we know, the main code sets are ICD, CPT and HCPCS. So to elaborate it, you have to define what is ICD, what is CPT and what is HCPCS. Then it will take few time also, no? So that to hear it will be quite interesting. So now we'll move on with the second question. What is the purpose of ICD-10-CM codes? So here ICD-10-CM codes are used to classify diseases and health problems for the purpose of medical billing, statistical tracking and epidemiological research. This one I have given. You can find your own answers and you can say it. Okay, this is what I know I have added here. Now we'll move on with the third question. Explain the difference between ICD-10-CM and ICD-10-PCS. So ICD-10-CM is mainly into diagnosis coding, whereas ICD-10-PCS is into procedure coding system. And this PCS codes we mainly use to code hospital inpatient settings codes. Okay, you can do Google and you can find your answers. Okay, so next question is, explain the difference between CPT and ICD-10-PCS. CPT is current procedural terminology. It is used to report medical, surgical and diagnostic services, and mainly it is done in the outpatient setting, whereas ICD-10-PCS on the other hand is specifically designed to code the procedures and service provided during the inpatient stay, such as surgeries, medical treatment and interventions. Next question, what does CPT stands for and what is its purpose? Okay, so for explaining this, you can say what is the full form of CPT, and mainly it is done in the outpatient setting, and the CPT codes are developed by AMA. And what are the purposes? Main thing is documentation, and second one is research and analysis. For documentation, you can see the definition which I given, and you can say that also. And next question, what is the purpose of HCPCS code? HCPCS means Healthcare Common Procedure Coding System, and it is mainly used to code the products, supplies and services which are not included in the CPT codes, such as durable medical equipment, prosthetics, orthotics and supplies when used outside a physician office. Next question is, explain the concept of upcoding and why it is important to avoid. Upcoding, which means the practice of assigning a higher level billing code to a patient diagnosis or procedure than what is supported by the documentation. Exactly, it is a fraud like thing. Okay, essentially it involves inflating the complexity or severity of the patient condition here. So upcoding is illegal, unethical. Okay, then what are the main steps in medical coding process? So in medical, this is what like RCM cycle they are talking about. So main steps are patient registration, medical record review, code assignment, claim submission and reimbursement. This is also an important question only, so you can take a note of it and keep. I'm posting this because one of my subscriber have asked for this questions, that's why. Next, what is the difference between inpatient and outpatient coding? Inpatient means complete coding services provided to the patient who is admitted in the hospital, and outpatient means who receives care in the hospital or clinic without being admitted for a overnight stay. That is outpatient. Okay, it is not meant you have to say the same thing which I have given. You can find your answer also. Next question, how do you handle situation where the documentation is incomplete or unclear? In such situation, we have to consult with the healthcare provider and get a proper clarification for the documentation. If necessary, you can query the provider also for additional information. So next we'll move on with the next question. What are the key elements required for accurate code assignment? So the key elements are, first we have to understand the patient diagnosis, and you have to see what procedure is performed, find out the date of services and check for any relevant modifiers and any additional documentation is given. These are the things which you should be very clear while coding, and you have to check for all these data in the patient chart. Next question, what are the ENM code and how they are used? ENM codes are evaluation and management codes, usually used to report services provided by the healthcare provider for evaluating and providing management to the patient. Mainly these codes are based on the complexity of the patient condition and the level of the service provided. So this is all about the definition which you can tell them when the question is asked. If any additional points should be added from your side also, you can do it, no worries in that. Next question, I don't think there is another question in this. So okay, so if you haven't subscribed my channel, please do subscribe, and if you find it useful, please do put a like and a comment also. So wish you all the best for your interview. I am adding or 3 or 4 parts of interview questions for UAE, so that you can go through that also. Okay, thank you so much for your time. Thank you. And okay, so in the iCard I'll be adding the interview questions. You can go through it.